Today I'd like to talk about hernias. Hernias are essentially a hole in the abdominal wall through which the lining of the abdomen, or if they are larger, actual loops of bowel can protrude through. They are very common, and generally speaking, they occur in naturally weak spots in the abdominal wall, predominantly in the groin, but also can occur around the umbilicus or belly button, or above it, and also in areas where there have been previous scars or incisions from surgery. Groin hernias we normally call inguinal hernias, depending on their position, but there's another one called a femoral hernia. The umbilical or belly button hernias are umbilical hernias, and the ones following surgery are called incisional hernias. Each have different reasons for treatment. Some can be left alone, and there's different surgical options for each of the different hernias. Any hernia can cause complications if the bowel or the lining gets stuck in the hernia or through the little hole and gets tight. This can cause an obstruction of the bowel or a blockage, which means that the abdomen becomes distended and painful. And at times, the blood supply to that bit of bowel can get reduced, and that portion of bowel can actually become gangrenous. This isn't a frequent occurrence, however, and the vast majority of hernias will just be a swelling at various sites in the abdomen, which can be uncomfortable, but doesn't need emergency surgery. Having said that, a hernia will never disappear spontaneously by itself. If you are diagnosed with a hernia, I'd strongly recommend that you get a surgical opinion as to whether this hernia should be repaired with some form of operation. Very small hernias can be left alone, but should be monitored, as they will, over time, increase in size, and as they do so, increase the risk of an emergency presentation, which completely changes the operative strategy and can be quite life-threatening, particularly to the more elderly patient. The majority of hernias will need an operation at some stage. When hernias first present, they're often just noticed incidentally by a small swelling in the groin, perhaps when you're showering. This hernia may then disappear when you're lying down or sitting down, and that's the natural response to a hernia with gravity. As you sit back, gravity relaxes and the hernia drops back. They will never disappear, however, spontaneously by themselves, and with time will grow. For the majority of patients, the hernias will increase in size slowly over a period of months, and then start to cause some symptoms such as dragging or discomfort or even pain towards the end of the day. However, some groin hernias may not become symptomatic or cause any problems for a number of years. With the guarantee that the hernia will never disappear by itself, and with the risk always there of presenting as an emergency, we do recommend that unless the patient is very unfit or the hernia remains very unsmall, that most hernias should be repaired, particularly in the groin, as this is the commonest place for an emergency presentation to occur. The hernia surgery, particularly for the groin, is generally speaking performed in a hospital setting, but most often, unless the patient is particularly unfit or the hernia is very large, we can do this as a day case. So patients are in and out the same day. We do tend to do it under a light general anesthetic, so the patient is asleep, but there's a rapid recovery from the anesthetic. Once we've fixed the hernia and done the procedure, we'll tend to put long-acting local anesthetic in the wound so that the patient is comfortable for the next 8 to 18 hours. Hernias can be repaired under a local anesthetic alone or with some sedation. However, that's not the favoured approach for the majority of surgeons in the UK. Before any surgical procedure, particularly for hernia repair, we like patients to be as fit as possible and to keep mobile. They should avoid excessively heavy lifting or excessive vigorous exercise, as this can push the hernia out further and potentially cause an emergency presentation. Weight loss is often quite useful, as it reduces the pressure on the hernia and allows the reduction in the wound size that we use, and also improves the healing overall. However, we're not expecting that patients will dramatically lose weight, as it doesn't make that much difference to the procedure itself. We do recommend that patients stop smoking if they're a smoker for several weeks before the procedure, as stopping smoking does improve wound healing, and that will allow the hernia repair to fix itself nicely over the 3 to 4 week recovery, and that does reduce the risk of a hernia recurrence, which can occur in 2 or 3% of cases. The operation itself to repair a groin hernia usually takes around 40 to 50 minutes. It's done under a general anaesthetic usually, although it can be done under a local anaesthetic with sedation. We prefer the general anaesthetic approach, as it keeps the patient perfectly comfortable, but it is a light anaesthetic, so recovery from that point of view is very quick. During the operation, we'll find the hernia, reduce it back into the abdomen, suture the hole, and then insert a piece of mesh over that whole weakened area to strengthen it and reduce the chance of the hernia coming back. At the end of the operation, we'll put some long-acting local anaesthetic in the wound to keep you comfortable for the next few hours as you recover on the ward, and then are able to take some tablet painkillers to get you up and about and back home. Following a hernia repair, it can be quite painful for the first 2 or 3 days, and we recommend that patients take painkillers, which would be prescribed regularly for 2 or 3 days, and then hopefully wean off those painkillers down to paracetamol or nothing by the end of the first week. We want you to keep mobile, keep walking around, doing normal activities of daily living, but do suggest that you avoid heavy lifting for 3 to 4 weeks. Carrying a shopping bag, an overnight bag, normal everyday activities are perfectly fine and will not disrupt the repair. Driving is recommended that you don't drive for a week to 10 days. Driving itself would not cause a problem with a hernia repair, but if you were involved in an emergency situation, and particularly with a right groin hernia, you may not be able to stamp on the brake hard enough to avoid a collision. And if you were involved in some form of accident a few days after a hernia repair, you may be blamed even if it's not your fault. So it's more of an insurance issue rather than actual doing any damage or being dangerous to drive with following a hernia repair. In terms of exercise, walking as far as is comfortable straight away after the surgery is not a problem. This is a tension-free repair, and the mesh should reinforce all that. In terms of more vigorous exercise, gentle cycling, particularly on a static bike, will be fine from 2 to 3 weeks, and then really get back to normal activities at 4 weeks where there is virtually maximum strength.